Relafin 50 mg tablet is a selective serotonin reuptake inhibitor, SSRI, used primarily to treat various psychiatric conditions. It is commonly prescribed for obsessive-compulsive disorder, OCD, panic disorder, and social anxiety disorder. Fluvoxamine is known for its effectiveness in enhancing mood and alleviating anxiety by influencing serotonin levels in the brain. Uses. Relafin 50 mg tablet is used for the following conditions. Obsessive-compulsive disorder, OCD, to reduce the frequency and severity of obsessive thoughts and compulsive behaviors. Panic disorder, to decrease the occurrence and severity of panic attacks. Social anxiety disorder, to alleviate symptoms of extreme shyness and fear in social situations. Depression, though less commonly, it is sometimes used off-label for the treatment of major depressive disorder. Mechanism of action. Relafin 50 mg tablet works by selectively inhibiting the reuptake of serotonin in the brain, thereby increasing the levels of serotonin available in the synaptic cleft. This enhancement of serotonin neurotransmission is believed to contribute to its therapeutic effects in reducing symptoms of anxiety and depression. How long does it take to work? The therapeutic effects of Relafin 50 mg tablet may take several weeks to become noticeable. Generally, patients may begin to see improvements in their symptoms within 2 to 4 weeks of starting treatment, but optimal effects might take up to 8 weeks or longer. It is important to continue taking the medication as prescribed even if immediate improvements are not observed. Absorption. Relafin 50 mg tablet is well absorbed after oral administration. It reaches peak plasma concentrations within about 1 to 3 hours. The absorption rate is not significantly affected by food intake, allowing for flexible dosing with or without meals. Route of elimination. Fluvoxamine is primarily metabolized in the liver by cytochrome P450 enzymes, mainly CYP1A2 and CYP2D6. It is excreted mainly through the kidneys in the form of metabolites. The elimination process involves both renal and hepatic pathways. Dosage. The dosage of Relafin 50 mg tablet varies depending on the condition being treated and the patient's response to the medication. Obsessive-compulsive disorder, OCD, typically, the initial dose is 50 mg per day, which may be gradually increased to a maximum of 300 mg per day, depending on patient response and tolerance. Panic disorder. The initial dose is usually 50 mg per day, with gradual increases as needed, up to 300 mg per day. Social anxiety disorder. Starting doses are often 50 mg per day, with potential increases up to 300 mg per day. Dosage adjustments should be made based on clinical response and tolerance, and it is important to follow the prescribing healthcare provider's instructions. Administration. Relafin 50 mg tablet is administered orally in the form of tablets or extended-release capsules. It is typically taken once or twice daily, with or without food. The medication should be taken consistently at the same time each day to maintain steady blood levels. Side effects. Common side effects of Relafin 50 mg tablet include nausea, headache, dry mouth, drowsiness or insomnia, sexual dysfunction, weight gain. Some individuals may also experience more serious side effects, such as suicidal thoughts, severe allergic reactions, or serotonin syndrome, which require immediate medical attention. Toxicity. In cases of overdose, symptoms may include nausea, vomiting, dizziness, tremors, and agitation. Severe cases may lead to serotonin syndrome or seizures. Immediate medical attention is necessary in case of suspected overdose. Precautions. Precautions include monitoring for signs of suicidal thoughts or behavior, especially in young adults and adolescents. Assessing for any history of liver dysfunction or renal impairment, as dosage adjustments may be necessary. Being cautious in patients with a history of bipolar disorder, as SSRIs may induce manic episodes. Interaction. Relafin 50 mg tablet may interact with other medications, including monoamine oxidase inhibitors, MAOIs. Combining with MAOIs can lead to severe serotonin syndrome. 1 cypriot pound A2 and CYP2D6 substrates. Fluvoxamine can inhibit these enzymes, affecting the metabolism of other drugs. Warfarin, may increase bleeding risk due to interaction with anticoagulants. It is important to inform healthcare providers of all medications being taken to avoid potential interactions. Disease interaction. Fluvoxamine should be used with caution in individuals with seizure disorders, may increase the risk of seizures. Severe liver or kidney disease, dosage adjustments may be needed. Bipolar disorder, risk of inducing manic episodes, use with caution. Drug interaction. Fluvoxamine may interact with antidepressants, risk of serotonin syndrome when combined with other SSRIs or serotonergic drugs. Antipsychotics, potential for altered levels of antipsychotic medications. Anticoagulants, increased risk of bleeding. Food interactions. There are no specific food interactions with Relafin 50 mg tablet. However, it is recommended to take the medication consistently with or without food as directed by the healthcare provider. Pregnancy use. Relafin 50 mg tablet is classified as Category C for pregnancy. This means that risk cannot be ruled out, and it should only be used if the potential benefits outweigh the risks. Consult a healthcare provider to evaluate the potential risks and benefits of using this medication during pregnancy. Lactation use. Relafin 50 mg tablet is excreted in breast milk. The decision to use this medication while breastfeeding should be made in consultation with a healthcare provider, considering the potential risks to the infant and the benefits to the mother. Acute overdose. Symptoms of acute overdose may include severe drowsiness, nausea, vomiting, agitation, and, in extreme cases, seizures or serotonin syndrome. Immediate medical attention is required in case of an overdose. Contraindication. Relafin 50 mg tablet is contraindicated in individuals who are taking MAOIs or have recently stopped taking them, have a known hypersensitivity to fluvoxamine or any component of the formulation. Use direction. Follow the prescribing healthcare provider's instructions for dosage and administration. Consistency in taking the medication is key to achieving therapeutic benefits. Storage conditions. Store Relafin 50 mg tablet at room temperature, away from moisture and direct sunlight. Keep it out of reach of children. Follow specific storage instructions provided by the manufacturer. Volume of distribution. The volume of distribution of Relafin 50 mg tablet is approximately 13 to 20 L per kilogram. It is widely distributed throughout the body, including the central nervous system. Half-life. The elimination half-life of Relafin 50 mg tablet ranges from approximately 15 to 20 hours. This means the drug remains in the body for an extended period after administration, which supports once or twice daily dosing. Clearance. Relafin 50 mg tablet is primarily cleared by hepatic metabolism, with renal excretion accounting for a minor portion of clearance. The clearance rate can be affected by liver function and the use of other medications.